everyone, welcome to another episode of Excela Health Virtual Mall Walkers. Today is Thursday, May 28th, which would have been our Mall Walkers Day at the mall. While we're not able to meet with you in person, we know we can still have mall walkers and connect with you right at home. We're really excited to be able to offer another featured physician presentation for you today. Excela Health and the American Heart Association partnered together to offer a community conversation webinar surrounding COVID-19 and its effects on heart health and stroke. Excela Health interventional cardiologist, Dr. Nevin Baker, was a featured panelist, and he offered his insights on how the pandemic affects our heart health and stroke. We'll be hearing a little bit later from Dr. Baker, but first, let's check in with Dawn DeVoli for another segment of What's in Your Pantry.
Hi everyone, welcome back to my kitchen and welcome back to another week of What's in Your Pantry. Before we get started with today's recipe, I have some announcements for you. First off, we have a winner to the Cookbook Raffle, and Laura will be giving you details on who our winner is. Another announcement I have for you is that today is the fourth Thursday of the month. And in normal times, we would have been at the mall. And because we're not, we feel bad about that. So we are planning another giveaway for you this week. So you want to stay tuned. This giveaway does include another cookbook and as well as some additional kitchen gadgets. Some Excela Health logo merchandise. So you'll want to stay tuned and listen to what Laura has to say on how you can register for this week's giveaway. All right, so today what we're going to do is we are going to talk about summertime. Can you believe it's almost summer? I'm so glad. I love this time of year because most of my cooking in the summertime takes me outside. And I try to make fresh meals using things maybe that come from my garden or maybe produce that I buy at the farmer's market. But anyways, I cook very differently in the summertime. So I thought I'd give you a little tease for a summertime recipe. And today we are going to be making chilled dark chocolate fruit kabobs. Now, another thing about this recipe, it is also found in this cookbook. Okay, sticking with the Mediterranean diet theme this month. It happens to be a very quick recipe. It could be a healthy snack. And it's also nice enough that you could even serve it as a low-calorie dessert if you're having people over for a nice meal. So let's go over the ingredients. On the recipe, I always offer substitutions. So as we're going through the foods in the recipe, I can give you some substitutes. Maybe you don't have certain things in your pantry, or you don't like some of the things that are on these fruit kabobs. So on the fruit kabobs, we're going to put various types of fruits. Okay, so the recipe calls for 4 different fruits. I happen to have in my refrigerator pineapple chunks, blueberries, strawberries, and blackberries. So we're going to use these fruits in our kebab. Now this is so easy to do, honestly. What you're going to do is you're just going to start with a wooden skewer. I bought these skewers at the dollar store. And you're just going to thread the fruit onto your skewer. Okay, so I'm using the pineapple. Okay, the recipe did call for fresh cherries, and I didn't have those, so I'm using fresh pineapple that I had. We're going to add some blueberries. Any kind of berry would do here. So blueberries, strawberries, and you can put these on however you wish. There's no right or wrong way. I think this would be a fun activity to do as a family, or if you have some grandkids, they could certainly help you assemble these skewers. Okay, and the strawberry, and we're going to top it off with a blackberry. Here we go. Okay, so you can see I've assembled some of these already. Now what we're going to do next is we have to drizzle these with chocolate, and I'm using dark chocolate chips, and I'm going to put these in the microwave. Okay, and while those are melting, let's talk about some other fruits that you could substitute in these fruit kebabs. So of course I'm using a lot of berries. I happen to love berries. I think they're super healthy. They are low in calories. They are high in fiber. They are a good source of vitamin C, and they also have antioxidants that keep our heart healthy and our brain healthy. Okay, so, but if you don't have berries, I think something that you could substitute for these fruit kebabs would be maybe canned peaches, or maybe you have mandarin oranges. I think another nice option would be dried apricots or dried figs. You know, we don't want to forget about the dried fruits as well. I think bananas would also be good on these. Again, canned fruit would be another option. Maybe you like canned pears. I think you could put canned pears on those. Let's check the chocolate. All right. I think it needs more time. You know, melting chocolate in the microwave is always a guess. But the one thing you don't want to do is burn it. Because what we're going to do with this dark chocolate is we're going to drizzle it over our fruit kebabs. And these chocolate that we're using is a dark chocolate, which happens to be super healthy. If you're choosing dark chocolate, because of its health benefits, you want to find a dark chocolate that has at least 70% cacao in it. Okay, that's important, 70%. Dark chocolate is also full of antioxidants to help our heart and our brain. So let's take a look at this chocolate. All right, I'm going to stir this up a little bit. Oh yeah, this is perfect. Okay, so in case you were wondering, this is about a cup of dark chocolate chips, and I melted them for 1.5 minutes. Okay, so look, this is like the perfect consistency. All right, what we're gonna do now is we're gonna make a homemade piping instrument. So we're gonna take our dark chocolate and we're gonna put it in the baggie. And if you're working with your grandchildren on this, you might want to be the one to do this step because this chocolate is super hot. And we wouldn't want anybody to get burnt. So you yourself need to be careful as well. Okay, so we're taking this chocolate and we're gonna cut the tip off of a corner. And then we're gonna coax this chocolate down to that corner. And then we're gonna squeeze it out and drizzle it all over our fruit kebabs. Like this. Okay, so you can drizzle it in any pattern you want. No rhyme or reason to this. And then we're gonna let this chocolate sit. The recipe calls for you to put it in the freezer for about 20 minutes, but I'm thinking that this chocolate is just gonna set on its own. Now, if it was a super hot day, you might wanna put it in the freezer, but I think that's about all I'm gonna get out of there. All right. Okay, so there you have it. A masterpiece. These dark chocolate fruit kebabs. One kebab is a serving, and it has about 250 calories. It has about 4 grams of fiber. So you can see that this could be a healthy snack or a healthy dessert. The healthy habit here is you want to give me 5, right? 5 servings of fruits and vegetables a day. That's what the current recommendation is. And you want to keep in mind with your fruits and vegetables, the best thing to do is pick things that are very colorful, right? So the fruits and the vegetables that are red, purple, and blue, like the berries that we have here on the Kabobs, those colors are super high in antioxidants that help protect our heart and our brain. So you want to be sure that you include those colors in your fruit and vegetable choices. So that is the end of our recipe. Okay, so I hope you would give this a try. I think it's super easy. I want to thank you for pressing the play button once again on these cooking videos. I hope you're enjoying them as much as I am. And I want to let you know that for the month of June, we have a lot of very exciting things planned for you in our virtual mall walkers. One thing that I plan on doing for June is I plan on taking my kitchen outside and maybe doing some videos on my deck where we can talk about healthy chilled beverages for the summer, maybe do some healthy grilling, some summer salads, and add flavor to some of the dishes that we may be already making by using dips and spreads and salsas. So you want to be sure to stay tuned for that. All right, so again, Laura has some very important information for you on how you can enter our giveaway for this week's raffle basket, and I will see you in June. So until then, stay healthy and make sure you come back and maybe bring a friend. Bye-bye.
Welcome back, mall walkers. We hope you enjoyed today's healthy treat cooking demonstration and our healthy habits tip of the day. Be sure to check your email inbox for some additional content that we've sent to you, including 3 healthy recipes, the bonus recipe that Dawn just showed us in her video, an exercise challenge, a decompress your stress segment, and some additional resources that will benefit you in your overall health and wellness journey. As Dawn mentioned, today is our Mall Walkers Day, so we wanted to do something a little bit bigger and better for our giveaway. We're going to be giving away a cookbook, some kitchen items, and some Excela Health logoed merchandise. So you'll be able to win all of these items. How do you win? Here's how you can enter. In your email, you were given a survey link. We would like you to fill out this short survey. For June, we're thinking about doing a live Mall Walkers event on the computer, and we want to know if it's something you'd be interested in participating in. So just tell us, yes or no. It's that simple. Please make sure that you fill out all of the fields in the survey so you can be entered to win the basket giveaway for today. Thank you all so much for joining us for our Mall Walkers Day episode. Up next, we have Dr. Baker and the Community Conversations webinar. So stick around and stay tuned. We'll see you next week. Have a great day.
Good afternoon. Thank you for joining us today. I'm Trish Desvaro, Division Director with the American Heart Association here in Southwestern Pennsylvania. We are thrilled to have you join us for a community conversation on matters related to COVID-19 and their impact on our region. The American Heart Association is working with researchers, medical experts, community leaders, businesses, families, and more to reduce the impact of the coronavirus. Our top priority is the health and well-being of all individuals and their families, locally and across the globe. We want to keep you informed with trusted, science-based information and provide our communities with support and resources available through the AHA. Today, we are joined by three local experts: cardiologist Dr. Nevin Baker of Excela Health, Dr. Brian Eberts of Chestnut Ridge Counseling Services, and Gina Harach, also of the American Heart Association. They will begin our conversation, but we want this to be a dialogue, so we are looking forward to hearing from you as well. Please feel free to place your questions and comments in the Q&A box throughout the presentations, and we will ask your questions during the Q&A section with our speakers after they have each shared their portion of the presentation today. I also want to let you know that we're recording today's event, and it will be available on demand through the webinar link. Our speakers today are going to be discussing COVID-19 with specific attention to what people living with heart disease and hypertension or who are stroke survivors should know. How the pandemic is also impacting mental health is also something that we're going to be discussing today, and also how the American Heart Association is spearheading research and providing critical guidelines for healthcare providers. Now, I'd like to introduce Dr. Nevin Baker. Dr. Baker is an interventional cardiologist with Excela Health in Westmoreland County. Dr. Baker, first I want to thank you for being on the front lines of this health crisis and treating and caring for our community members and their families every day. I think I speak for all of us how much we appreciate your leadership and commitment during this difficult time. Thank you so much. Can you share with us the latest on the pandemic from your position as a cardiologist?
Sure, Trish. Thank you. I appreciate the AHA letting us do this and the information we can provide to the folks in our communities here. I think it's important for those that are listening there to understand that the pandemic that we have, and from a cardiovascular standpoint, has really impacted the way that we're practicing medicine. For the first time ever, we're using telehealth. We're restricting access. Where otherwise you'd be able to walk into an ER and not have to be bound up or have all the PPE equipment on. It really has changed how things are being managed. The spectrum of the disease of this COVID and cardiovascular health ranges from very, very mild illness to very, very severe respiratory distress syndrome. And the impact that it has directly to the heart is quite variable. And it's obviously based on risk factors, traditional risk factors for cardiovascular disease. We found that folks that have had prior cardiac disease, those who are diabetic, hypertension, even pre-existing lung conditions, when contracting the COVID virus, seem to be most severely impacted. Often, we've seen the heart be an innocent bystander through all this. And what I mean by an innocent bystander is that the virus, when in a severe form, is affecting the lungs and the pulmonary function. And if the lungs are significantly involved and the body's deprived of oxygen-rich, blood cells going into the heart can cause a stress-induced heart attack. We've also seen that the virus itself seems to cause a pro-clotting event, a thrombotic event, meaning that folks with the virus seem to be more at risk of forming blood clots, lung blood clots, heart blood clots, brain blood clots. It's really incompletely understood why that is. We'll know more in the months ahead as we get more patients and study why this is affecting the body's coagulation process. But I think that overall, we're managing the cardiovascular events as best we can. We're avid from the time the patients reach the emergency department till the time they're working through the ER and understanding if they're having a heart attack, if it's related to the COVID virus, if it's not, how to protect patients, how to protect ourselves. The virus has been a game changer, but we're fortunate we're coming out on top here, it looks like.
Dr. Baker, do you have, I know you mentioned telemedicine. How's that working?
Yeah, telemedicine has been amazing. I have to thank our IT department here at Excela. I mean, from the when we essentially when everything got on lockdown and we knew that we were no longer going to be bringing patients into the office to see them, our IT department and we had some champions. Dr. Arvind Vasudevan was one of those. He's in our neurology department, had worked with telehealth prior to coming to Excela. And between our IT department and some champions at Excela, we were able to quickly ramp up telehealth, either phone calls like we're having right now, which are video, or just telephone calls on their own. And it's worked out. We worked the bugs out in the first few weeks. And then I think the patients that we're able to communicate with through this and have taken advantage of the availability to still speak with their physicians and providers during this time and not have interrupted healthcare, I think has been amazing. And I think that there'll be many changes that will come about after this is all finished, but I think telemedicine will become a very viable, often, I would say, frontline way of communicating with your patients, keeping them safe at home at times when they need to be, and bringing them in the office when they're able to be in the office. It's really been remarkable how we've been able to come around and use the technology that we have to keep patients safe and keep caring for them during this time.
You know, I know you mentioned some issues with blood clotting, and there's, you know, a lot of reports talking about the pattern between COVID-19 and stroke in younger people, like in their late 20s, 30s, 40s. You know, what can you tell us about that?
Yeah, I think that, as I had alluded to when we first started the conversation, this COVID virus seems to be influencing coagulation cascades in the body, more so maybe than we see with a typical viral or bacterial infection. Again, what we understand in the medical profession right now, from cardiovascular, intensive care, I mean, every service line, we are giving our educated guess. That's a hypothesis, and we don't have hard science as to what is exactly going on, but we do see that with this virus and in younger patients, stroke has been a concern here recently. Case reports are what the medical community puts out into the literature to other physicians and eventually the patients and the general population. When we see something that just does not make sense, when we start collecting these cases, they're called case reports. And so we put these case reports together, and we found there have been young folks, 30s, 40s, without the traditional risk factors that have presented with stroke. One of the hypotheses, again, the educated guess on why this might be or why it might occur, it has something to do with the virus affecting that coagulation cascade and ramping it up, I guess, is a way to describe it, but making the body want to clot more than it typically would. I guess I might give an example. If you're running away from a tiger, and you got your fight or flight responses going, you want everything ready to go in case that tiger catches you. But in the sense of the virus being there, the virus seems to be pretty tough on bodies, and otherwise healthy young folks that have strong immune systems want to kick this thing best they can. We think that part of that immune response is also met with an increased risk of clotting in your body. And again, the heart and the blood vessels are just innocent bystanders. They're doing what they're told to do. They're pumping out all the factors, the good things, the bad things, the things that you need to have done, the things that you got to be ready on standby if the tiger catches you. It just seems to be a real, maybe overproduction or a vigorous effort on the body's part that's causing this.
Yeah, interesting analogy. Thank you. I want to remind everybody to please use the Q&A box to ask questions. We can maybe field a question or two now, but we will also have a Q&A section at the end that we can ask and direct questions to each of our panelists. So I do encourage that. I have one other, just one other point or question I'd like to ask you, Dr. Baker. Data is showing that racial and ethnic minorities are dying from COVID-19 in rates that are, pretty disproportionate to their population size in many cities. What are your thoughts about this and what may be driving these patterns?
Yeah, I think who you're mentioning is a vulnerable patient population for us. Vulnerable in the sense that may not have the access to healthcare, may not have the access to medication for various reasons. Transportation might be rural or remote. Financial may not be able to afford. So I think that combined with that, this population often is a population that has a lot of the traditional cardiovascular risk factors. Could be smoking, increased prevalence of smoking in the population, obesity, hypertension, diabetes, those that we had mentioned put you at risk if you have the virus. So I think that if you combine a pre-existing condition that may make the virus a more severe infection for a person, on top of the inability to either seek adequate health care promptly or have a condition that's not being very well treated at baseline because of a disparity, whatever it may be related to, it's like throwing fuel on the fire. It's a tough situation to overcome. So I think between those two things is why we might see that population significantly affected.
Okay. Any extra, thoughts about, what people can continue to do to protect themselves from the virus?
Yeah, we still ask folks as we're moving between these colors, red to yellow, yellow to green, as our government's trying to open up, be diligent with your personal protective equipment, your masking in public places. Still not a good time to gather in large crowds. If you're sick or you think you're sick, stay home and continue to socially distance yourself. We're not letting our guard down here. At Excela, we are opening back up as we are able to in different areas. We are doing elective procedures. We're doing it very thoughtfully and cautiously. We're following the guidelines that have been recommended locally and nationally to do that. We're asking patients to please be patient with us as we're doing this. I think the reason that we were able to flatten this curve and not really see a dramatic surge or an overwhelming surge was from the response we had from our patients in the population of staying at home, staying safe. I think that should still exist. It should still continue. But that if you need to come into the hospital, I think what I'd like to take this opportunity to tell you is that you should. If you think you are having a heart attack, if you think you're having a stroke, the hospital is a safe place for you to be at this point. It is much more dangerous for you to sit at home and let these symptoms linger on, and then we catch this days later, months later. We're still waiting to see the aftermath of having patients wait these events out at home, which I guarantee, and I may be talking to some of them right now, have done so. I can't speak for other healthcare systems in the area, but I do know that Excela has really done a remarkable job of making sure that folks are going to be safe in the emergency department when they come in. They're going to be safe in a physician's office. We'll be safe having procedures done. We're screening all these patients. Actually, it's mandated that they're going to get tested for the COVID before coming in for these elective procedures. So I think that as long as we maintain diligence, we're not letting our guard down, as I mentioned, and that patients are doing the same thing, life is going to go on in the medical community and the community around us.
Okay, I do have a question that just came through. There's a lot of conversation around healthy people wearing a mask. Does it really help to prevent the virus?
Yes. Here's what I would say about healthy folks. Healthy folks wearing a mask allows. I'll throw out a statistic that we have now that there's anywhere data saying 1, maybe 4, and I think 4 is high percentage, but think of 1 in 100 patients could be minimally symptomatic with COVID and be seropositive, meaning that you actually have the virus, but you don't feel too sick with it. So you take a healthy person that's walking around and they go and visit an elderly family member, friend, go in the grocery store, and you come in contact and have a 5-6 minute conversation with them without protective, personal protective gear on. What you've done is put that at-risk patient at serious risk. And I had mentioned before how the virus can be catastrophically dangerous for patients with certain medical conditions. So I do believe that continuing to wear your PPE, which is your personal protective equipment, is the right thing to do. Healthy folks that are walking around in and out of stores should continue to wear that. And that's not me from my opinion. That's medical professionals that are much smarter than I am above me, recommending to do that. But it makes sense. And I hope some of the information I've shared here with you will help you understand why it makes sense to continue to do that.
I have a few more questions that are coming through. Is someone on high blood pressure medicine more inclined to be at risk?
Certain high blood pressure medications. The one in particular that we are stopping if we feel a patient is in the hospital and we are actively testing them, not stopping this type of medication in the general population otherwise. But there are a classification of medications known as ACE inhibitors, angiotensin converting enzyme inhibitor, usually used for blood pressure. Lisinopril, Ramipril, Captopril, and a lot of medications that end in PRIL. Those type of medications, through various physiologic, metabolic effect on where they're targeted in the body to reduce your blood pressure, they're blocking an enzyme we feel may be up or down regulated with COVID positive patients and could exacerbate lung injury when you have it. So again, I want to make sure it's clear that we're not stopping these medications in the general population. We are holding them if you're in the hospital or if we're testing you for the virus and to make sure that you don't have it. But that's the big one that's gotten a lot of press, I suppose, of these ACE inhibitor medications.
Sure. We're starting to get a few more questions in as well. Would a heart patient be given TPA if a blood clot occurred while hospitalized for COVID?
Well, so that depends. I would say that currently we have the ability, at least, and I can speak for what we could do at Excela. As general population and other healthcare systems, but I would say that we're following with what folks around us are doing. So we've gotten to the point here where we're very comfortable with how we're triaging the acute heart attacks, meaning those that come in and are having the big one. They need to go to the catheterization lab, need to have us put stents in the arteries, open up blood flow, abort the heart attack. Because we are now well equipped with all our PPE, the cath lab and the negative airflow room, the ER staff knows how to triage these folks. I don't believe that TPA becomes has much of a role, to tell you the truth. I think we can adequately gear up and treat patients in our emergency departments with the standard of care, which is primary intervention with balloons and stents when you come in with a heart attack. Again, you take the necessary precautions, but I think still we have it in a timely manner. We understand the virus, the process, how things are working now. That wasn't the case 2 months ago, when we really didn't have an understanding of how to protect ourselves, how to protect other folks, how are we going to treat this. Going back to the idea of wearing these masks and kind of flattening out the curve, I think what that also helps do is allow the healthcare community to figure out, how are we going to treat this? How are we going to have, traditional care? I speak from a cardiovascular standpoint. How do we continue traditional cardiovascular care for cardiovascular patients during this time? We need time. We need the virus to die off in the area, numbers to go down. We need time for a vaccine to be developed. We need time to restock our shelves with all the PPE. And so continuing to be diligent about social distancing and wearing your mask is just allowing us to rebuild the healthcare field, giving us time to get a grasp on how we're going to treat this virus, and how we're going to give good standard of care ongoing to folks that need it and that come in with a heart attack. And that would be putting a stent in an artery as quickly as possible and not using a clot buster.
Right. Well, thank you so much, Dr. Baker. Please continue to ask your questions. We're going to have another Q&A session at the end before we close. So I really appreciate your insight and everything that you're doing on the front lines, but we'll be back with you. Now I'd like to introduce Dr. Brian Eberts. Dr. Brian Eberts has been an integral part of the mental health system in Fayette County for over 25 years. He has served as the medical director of Chestnut Ridge Counseling Services for about 13 years and continues to provide psychiatric care across a number of Chestnut Ridge mental health programs. Dr. Eberts is an active member of the Pennsylvania Psychiatric Leadership Council and was awarded the Pennsylvania Residential and Community Providers Association's Lifetime Achievement Award in 2019. Welcome, Dr. Eberts. We're delighted to have you with us today and very interested to have you share your observations on mental health during this time and any guidance you might have for those who are experiencing stress, depression, loneliness, or anxiety.
Thank you. So first, I'd like to really thank you again for having a section devoted to mental health, because a lot of times I think it gets somewhat overlooked, particularly in times of crises. So I appreciate that. So I'm going to try to focus my comments a bit more towards the Western Pennsylvania experience, which is in stark contrast in a way to what I might be saying if I were speaking right now on the East Coast. Even Allegheny County thus far has been relatively spared, the direct devastation of the virus, and particularly the profound impacts that it's had on individuals in the healthcare system trying to take care of them. So there have been a lot of what I would say appropriate discussions about the potential effects of this pandemic and shutdown on mental illness. I think certainly this event has had an impact on virtually everybody, but I think it's important to kind of make a differentiation between mental illness and kind of normal responses to highly abnormal situations such as what we're in now. The Army paid my way through medical school. I spent quite a few years as a psychiatrist then in the Army, and that experience really gave me a good education in a way at looking at the differences between mental illness and then symptoms, even some symptoms that can be pretty severe, that one might experience from like going through combat. And obviously, this isn't combat, though some people working in New York in the hospitals would certainly feel they're working in a combat environment there. But, all of us are, I don't know the average age of the audience here, but I suspect it's probably not as much people in their teens. We do fear for our own death, fear of death and illness happening to our friends. You go out and about in public and, anybody, including a friend, neighbor, or relative, could potentially be a vector of disease. But, these fears I think we need to look at as normal, similar as a soldier it would be normal for them to have fear going into combat. So later on, we'll talk a little bit about how to differentiate some of that. I think another huge area has just been grief and loss, both directly of people dying. You know, I have a patient who just died and his family's trying to figure out, you know, how do you have a funeral? People live all at different parts of the country. Are they coming in? Are they not coming in? People had lots of plans for the summer, right? Weddings, graduations, reunions, and to lose all that is a sense of grief and loss. Being unable to visit friends and relatives in the hospital or in nursing homes, I think, is a particularly challenging issue. But, you know, remarkably, humans are quite resilient. And somehow, you know, difficult as grief can be, you know, we manage to cope and get through these traumatic events. So I think the biggest concern is really going to be potential impacts on individuals economically. You know, some of us are pretty fortunate. You know, I've been pretty much unaffected by this economically. I still do my job remotely with the telehealth, as my cardiology colleague acknowledged. We're all adjusting and finding out, hey, this is working out pretty well. So from that perspective, it's not a direct impact economically. But if we have a surge in the fall and this goes on, you know, I think some of the economic impact on individuals could really take a toll. And, you know, we don't always, you don't really refer to that as illness. I think it's more appropriate to consider that kind of a disease of despair in a way. But fortunately, we've been pretty lucky that our elected leaders seem to have, I mean, this is the first time in years that they were able to, in a bipartisan manner, pass some legislation and rapidly. So that's really encouraging that hopefully that'll mitigate some of this, some of these issues. So, you know, there have been some estimates thrown out there as high as 175,000 additional deaths due to this from suicide, drug and alcohol use, and domestic violence. So, you know, obviously none of us have a crystal ball, but, you know, I did want to just speak briefly about what's the data on this. Suicide has been looked at in multiple things, like after 9/11, other traumatic events. Usually it actually goes down in the short term. And, you know, coroners are a little slow being able to get death certificates together in general, but it certainly doesn't seem like there's been an increase acutely. Again, if we're going to see that, I think it's going to be more if this really drags on an economic hardship increase. Looking at drug and alcohol, there's been some areas where it looks like there's been an increase already. Some places have actually seen a decrease, and they think it's probably related to the supply chain, just not getting through as effectively, just like everything else. And I think the drug and alcohol community is really tough because from a treatment perspective, so much of the treatment is really group related, social related, and that has been devastated. I think a lot of communities have done pretty well trying to do it remotely, Zoom meetings like what we're doing now. But for folks that are really kind of down and out, don't even have a smartphone with internet, you know, I do really feel for some of those folks. Domestic violence, I think that is one where we are already. I don't think there's any doubt we're seeing an increase there, and I think it's just you know, the economic stress, everybody being crammed together, the kids there, substance use, and just not a lot of avenues to get away. I actually saw an article on how many people are using their cars parked in the driveway as an escape from just being able to get some peace and quiet. But for individuals with more severe mental illness, schizophrenia, bipolar disorder, severe OCD, a lot of the stuff that I typically treat, for those individuals that are already in treatment, they've done remarkably well. I mean, they're experiencing the same things that all of us are struggling with. But I have really been impressed with the resilience of a lot of those folks. And I heard of woman with OCD who said, I have been practicing for this my whole life. Now's my time. So it's just interesting how different people respond. So one of the other questions was, you know, and it's kind of hard to give specific advice in a brief presentation, but when do you know when it's time to seek treatment? You know, everybody has their own way of handling grief and loss. I don't think there's any right or wrong there, and I think it's more related to, you know, how severe are the symptoms and how much are you struggling dealing with those symptoms. You know, the nice thing now with the internet that's just such a change from years past is there's great questionnaires out there on, do I have major depression? You know, are my symptoms panic disorder or OCD? And, you know, I think if people look at some of them, they might be able to get a little bit of a sense of, you know, how severe their symptoms are and if this is something serious enough that they should seek treatment or not. Certainly, if one is having thoughts they can't deal with the situation any longer, hopelessness, thoughts of, you know, life isn't worth living, my family would be better off without me, direct thoughts of ending one's life. I mean, those would obviously be times when, you know, you need to be seeking treatment, or for its friend or family member, you know, trying to get them into treatment. You know, we probably lose, you know, at least 45,000 people a year to suicide, and I wouldn't like to see that escalate with this. So the treatment might include more talk therapy for a lot of individuals, even than medication, and I think a lot of people are a little surprised by that. But similar to grief, rarely give people medications with grief. You know, it's something that we need to help people get through, because as horrible as it is, it's not mental illness in a way. Grief is not mental illness, and horrible symptoms that some people are experiencing with this does not necessarily make it mental illness. Not that we can't help people. You know, and originally in my training, I was trained to do the psychotherapy and the medication part. Now things have changed and I pretty much manage medicines more, but you know, that's okay. But there is help. So just it's very hard to give specific advice on how do you cope with this. You know, everybody is so individual. I don't think there's a one size fits all. Similar to grief, I think, again, if people spend a little time looking online, you'll find suggestions that will fit your personality. But I think there is some universal advice here. One, substance use. You know, I mean, if you find yourself sliding down that path of using that as a coping mechanism, that has to be addressed. And I think the next thing that I really like presenting here and is really in fitting with the American Heart Association is one of my major prescriptions for people is remaining physically active. And it's a hard prescription. People don't want to always hear it, but there have been multiple studies looking at mild to moderate anxiety and depression, and exercise being equal or potentially even more successful than Prozac and Zoloft. So that's a hard sell, I know, and some people say, well, I can't go to the gym, and my answer to that is some of the most fit human beings I've ever seen, even into middle age, were individuals in solitary confinement in prison. So it's, I'm not saying it's easy, but you don't need a gym to remain active and stay in decent shape. And lastly, I would say avoid too much news and media. You know, media thrives on fear. That's what gets ratings up. And like it or not, no matter what news station you watch, whether it's local, national, it doesn't matter. You know, they all know that fear gets people to tune into the news. And I would, you know, you need to keep up with what's going on in the world, but keep it in small doses. And in closing, I would say, you know, there is help during this pandemic. Both state governments, the federal government, they've really loosened up this stuff for us with the telehealth. Medicare just, I think last week said that, would be able to bill retroactive for telephone calls. I think mostly commercial insurers have kind of gotten on board. At Chestnut Ridge, we have some staff that are actually in the office, but for the most part, we're doing it some form of telehealth, and I think it's been pretty well received by patients and our staff. So help is literally right now just a phone call away. I'm in a statewide committee, and it really seems like most counties now, some struggled a little bit, but most counties now kind of have this down. And actually, copays and deductibles, which traditionally have been mighty high for mental health services, it looks like there's going to be a little bit of relief there as well, so it won't be quite the economic burden. And there's also the national resources, the suicide prevention hotline and other things. I was going to put the number up, but I think most people aren't going to, when you need it, you're just going to look it up on your phone these days. So on that note, I'll close and open for questions.
Well, I do just want to make one comment that you brought up about, with it being the American Heart Association and exercise being a great helper for depression and anxiety. I just want to mention to everyone that we have a ton of great resources on our website about that. I know some people have actually in the chat box right now, the National Suicide Prevention Lifeline toll-free number is on there, so you can make a note of that if you'd like. But there's some great resources at heart.org to help people with stress and managing anxiety and those types of things as well. I know there are tons of resources out there on the web to help people with these issues. I just wanted to ask you, Dr. Eberts, with this happening, I think people are finding themselves in positions they never thought that they would be in. And I think it's, a lot of times people are really starting to, question their mental health and maybe experiencing anxiety and depression. And, I don't know if you want to speak to maybe some of those symptoms that might come up that they may not be aware of because they're in this new stressful situation.
I think when I really get concerned is when when it's really starting to affect things like sleep, appetite, energy, and then drifting into, feelings of hopelessness, despair. And I know it's hard to ask for help. I certainly dealt with that with my years practicing in the Army. It wasn't easy for an infantryman or a special forces guy to ask for help. But, these are things that can be treated in ways to, even though the cause is outside of oneself, the cause isn't from in someone's brain here, like with schizophrenia. It's obviously external, but I think there are things that can be done to help people, kind of transition and get through these difficult times. When I see people, even people that have made some serious suicide attempts, even with gunshot, who have survived, the vast majority of individuals who have made serious attempts regret that they made the attempt. And somehow, at that moment, it seems like that is my only option. But after the fact, people start seeing, man, people do care. This was not a good choice to, shoot myself in the lung. And it just is sad, the number of people who do die, that I think had they managed to get through those moments of despair, that the intense feeling would have passed.
Well, keep those questions coming. We'll touch base again towards the end of the presentation. But right now, I'd like to, and thank you, Dr. Eberts, so much. It was great information. But right now, to introduce Gina Harach from the American Heart Association, excuse me. She serves as our Senior Director of Quality and Systems Improvement, and she's also a registered nurse with over 16 years of experience in critical care and emergency department nursing. Gina works with all the hospitals and EMS agencies in Western Pennsylvania and upstate New York to support disease-specific AHA or American Heart Association programs, including our Get With the Guidelines and quality outcomes. Thank you so much for your dedication and service as an ER nurse. Gina, the AHA has been relentless in our response to this pandemic to meet with critical and emergent needs. Can you share some of our specific work in relation to the research and guidelines that have been updated for our providers?
Hey Trish, happy to do so. Really honored to be able to talk about the work of the American Heart Association during this crisis, if you will. So the AHA really stepped forward early in the identification of COVID-19 to look at things around research and quality, those areas that everyone knows the AHA to be. And one of the things that we did very quickly were rapid action grants. So the AHA committed $2.5 million to research around COVID with cardiovascular disease and stroke. And what we know will be coming here within the next week or so are the final announcements of the awardees of those rapid action grants. So we're excited to hear more of what people are going to learn through their research about COVID-19 and that impact of cardiovascular disease and stroke. Down the same pipeline with research, the AHA quickly generated a COVID-19 registry, which is powered by our Get With the Guidelines programs. But this registry allows hospitals to collect information on all of their COVID-19 patients, looking at biomarkers through the time that they're hospitalized to determine what are the trends that may lead to different changes of the cardiovascular disease or stroke outcomes of these patients. And it's really exciting. We've had a lot of hospitals join on already, both nationally and now it's spreading to internationally, where we're seeing hospitals come forward and say, hey, we know that your Get With the Guidelines programs work. We want to get our information put into your COVID-19 registry. That will allow us as an organization to look at those tracks and trends across multiple patients, but it'll also let regions be able to look at the kind of effect of their patients on the COVID-19 disease that's out there, as well as look at some of the outcomes around cardiovascular disease and stroke. So really exciting. So far, the launch was just last week of the COVID-19 registry. And so far, nationally, we have over 300 patient records entered already into the system. So we're super excited for that to launch. Subsequently, the AHA has also put out a lot of guidelines and a lot of resources, both for our community and the healthcare worker in regards to COVID-19. I'll give you a few examples. One of those is around our card extension. So many people know healthcare workers, even the layperson in the community, get trained on CPR through the American Heart Association. And many of those cards have an expiration date. Those expiration dates have been extended for 120 days for CPR, as well as ACLS and PALS for the healthcare worker who has those requirements. We've also put CPR guidance out there to the public, both EMS and to the public bystander. So what does that mean? We have talked time over time about hands-only CPR. And what we know now is hands-only CPR has very similar outcomes as the normal compression and ventilation CPR that many people are aware of. What we're guiding our bystanders to do now is if they find somebody down in what would be assumed to be cardiac arrest, call 911. If you can, a mask over the patient, a mask over the bystander, and then hands-only CPR. No need for ventilation, no need for that mouth-to-mouth type of attempt that we're used to, but really in a life-saving manner, because we know that any type of CPR is better than no type of CPR. Right? So really kind of getting that guidance and those words out to everybody, community, healthcare workers, lay people. We've also put some guidance into play for EMS as well, just making sure that we're limiting, first and foremost, the number of people who need to be there. We will bring in the number of people that are needed to take care of the patient. But what we don't want to do are bring in excess groups of people that are going to expose themselves as well, right? So again, same type of thing. 911 gets there. If you don't need to be there, move on back, right? Personal protective equipment for our healthcare providers, and making sure that they can follow the same types of procedures, such as chest compressions, until they can get an advanced airway device in for breathing capabilities. Additionally, the AHA has put out a lot of different education, right? So two of the things I'd love to talk about are a recent webinar that we offered to our healthcare providers around resuscitation, ventilation, and ethical considerations with COVID-19. And then secondarily, on our website, we have a link to our oxygenation and ventilation toolkit. And what that toolkit is a 4-part video series, as well as some additional resources and assets that a healthcare provider who may be working in a COVID zone, who's not used to taking care of that type of patient, a patient on a ventilator, a critically ill patient, can kind of get a refresher, right? They can watch some videos about ventilation. They can watch some videos about kind of what is the best way and the best practice type of things, and then have resources and tools available for them as a refresher for those people who are kind of stepping out of their normal specialty and into an area that they're just not normally familiar with. So those are just a few of the research and guideline changes that we've put forward at the AHA in response to this pandemic recently.
I had to unmute myself. Gina, I wanted to, something else that's come up recently, and maybe even Dr. Baker can talk about this as well. People weren't showing up in the emergency room or calling 911 when they're having a cardiovascular event. And I just wondered if you could address that right now.
I absolutely can, Trish. So thanks again. That's a great point. So working with all of the hospitals in Western Pennsylvania, I've heard the same thing repetitively from all of my colleagues, which is the volumes in our hospital is down, right? Whether it is a stroke patient, a heart attack patient, a patient with medical issues. And I will note that each hospital, and I believe Dr. Baker said the same earlier, can take care of you very safely. Right? If you have any condition or any signs and symptoms that require a hospital visit, feel very comfortable going to your local hospital for that care. May is Stroke Awareness Month, so kind of putting my plug in there. Know about those fast symptoms such as a facial droop and arm weakness and speech difficulties, but T is time. So getting to the hospital on time and calling 911. Again, everybody is here to make sure that the patient receives the interventions that are needed in a quick manner. We do know in the case of stroke and sometimes in the realm of cardiology that a delay in arriving at the emergency department can completely change the interventions that are available to our patients. So getting there whenever those things are noticed, our hospitals are there to take care of you. They're there to make sure that you remain safe during this time as well. So if you notice signs and symptoms, comfortably know that you can go to your local emergency department for care.
So the key word here is don't hesitate, call 911.
That's right. That's right. And again, back to our 911 providers, they are ready, right? Our EMS teams are out there working, and they know, they're ready, they've been educated, and they're our front line. So everybody is very comfortable taking care of patients during this time. One last thing I want to add, Trish, is, the AHA has really also stepped up in the land of advocacy and making sure that federally, state, and locally, our politicians are hearing some of the requests of the AHA, again, about CPR, right? And making sure that everybody is trained in CPR. Pennsylvania passed CPR in schools last year. So we're seeing more people trained in CPR, but we're also working on PPE for the frontline providers, making sure that adequate PPE is available, as this crisis continues. But I am thrilled and honored to be part of the American Heart Association that has really put themselves in the front line of helping to eradicate this pandemic, right? And I use the word eradicate kind of loosely because we don't know enough about it, but in essence, really minimizing the effects of cardiovascular disease and stroke on the patients that this affects.
Thanks, Gina, so much. That was some really great information. I'm going to jump in now and kind of take some questions that we had posed earlier, and I'll direct them to whoever seems appropriate. I did have one come in earlier, and I believe this one's going to be for Dr. Baker. There's some background with this question. It says hospitals and clinics in Westmoreland County have entered into the yellow zone of restrictions and are going forward with scheduling elective procedures. While any procedure comes with risk of an adverse or worse outcome, those of a heart nature can add an increased level of anxiety for patient and family. At present, a family member of mine, this is the person asking the question, is scheduled to have an elective cardiac procedure this month. And it was placed on hold earlier. He has been told no family member may accompany him when he presents for this procedure. There's a lot of anxiety regarding this aspect and is causing him to consider canceling. What measures are being taken to address this issue, in particular, speaking to what Excela Health is doing?
Yeah, that's a good question, a real question, and I'm glad Brian's here to help me figure out some of this, because this is hard. Yes, Excela right now, we do have the policy of having a patient come in, and the same in the office, a patient without a significant other or family member to come in with. And so families are relying on the physicians to call before and after, or staff members to call before and after, and coordinate all amounts of care surrounding that visit, whether it's in the office or in a procedure via the telephone. And so I think in this particular situation, the reassurance that I want to give our patients and the individual asking the question here is that the goals of care and for what we need to continue to do is to take care of our patients, keep them safe, and then help to eradicate or level off the curve of this pandemic. And we've talked about the ways that we're doing that already. I believe that what we're doing from our health professionals, and when I say our providers, our physicians, nurses, mid-levels, nurse practitioners, everybody that's taking care of folks here in the hospital, are diligent and understand that it is difficult when you cannot be at your loved one's bedside when we're doing a procedure before or after. So that's why we're making sure that we talk to the patient's family before the procedure. We have their information. We put you on a speakerphone and call you after the procedure, and so that you can talk to your family member that's sitting right here next to us, and we can tell you exactly what we did, why we did what we did, and what the plan of care is going to be going forward after that point. I think just so that everybody knows that it's still important that we keep folks that are healthy, which these elective patients are. We've screened them, and we are screening patients coming into the hospital now for these procedures before they come into the door for COVID, and to make sure that they are safe. In doing so, you're helping to keep the healthcare professionals safe. And we're hoping to give the patient peace of mind and their family members peace of mind following that afterwards. Maybe, as far as the anxiety and how to deal with that, I might ask Brian's opinion on what he might recommend, not only for the patients, but for the healthcare providers that are listening right now, I feel communication always is solid, understanding, before the procedure a call, after the procedure a call, being in the presence and letting the family member hear the voice of the family member undergoing the procedure. How else might you help to mitigate the anxiety, not so much of the patient, but of the family member that is waiting for the call to know how the procedure went?
Well, I have to say, Nevin, I think you really nailed it. It's communication and letting people know how much you're going to be able to be in contact with them. Because I've already dealt with that with some of my folks. They're saying, well, I'm going to wait until this is over. They said, well, we might not be back to normal in hospitals and nursing homes for 6 to 12 months. We don't know. And I think you're right. I think if you approach it like you just described now and give people that level of detail of how it's going to work, I think most people are going to come around and realize, hey, I got to, the patient's going to realize and the family members are going to realize that, this is going to be tough, but we can't put this off forever, right? And helping, I think there's just too many people that are thinking that, the country's open up and maybe this will be over by June 1st. And I'm sure from your perspective at Excela, you don't anticipate visitors in the hospital June 1st.
No.
I think we need to be kind of brutally honest with people. And, by and large, I think most people, even people with a lot of serious mental health issues that I deal with, will get it if you spend the time on communication. So I think you really nailed it.
And I would say, too, that trust your provider. Trust the doctor, physician assistant, whoever it might be that's telling you, you know what, we've managed this with medication long enough, and it's time now to have a surgery, have a heart catheterization, have your stress test. It's time now to be definitive. I think that, I'm speaking for the providers that I work with at Excela, that I trust their opinion and I trust that they're making a good decision for our patients. And so when they say, you know what, this patient needs to have a procedure done, I would say trust your healthcare provider. They're on your side. Trish, I think you're muted still.
Oops, thank you. We have another question for you, Dr. Baker, and maybe even Dr. Evers can, and this might be our last question. There are a few other questions on line that we will address, and we'll answer those offline for everyone, but I wanted to put this one out as well. Someone asked if someone has dementia, is there an exception for someone to accompany them in the hospital if they're having a procedure?
Ooh, that, yeah, I'm not sure about. So I can speak to if a patient needs a procedure, which I would perform, like a heart catheterization procedure being done, and the patient has dementia and is not able to understand, comprehend, or sign the consent form, that would still be something that we give or take a verbal phone call communication for. That was actually fairly standard. I did a procedure today where a patient was on a ventilator and I had to call the family to get consent, and that would have taken place regardless of if they were able to be right in the hospital or not, to get a verbal consent like that. So we may have to find out what the healthcare system's policy is on that. But what I guess to answer the question as best I can, if there is a medical necessity where we believe that the patient would be at increased risk or harm of not having the family member present, where I suppose I could see certain cases where that could manifest, then there's always an exception to the rule. But in a lot of cases where the patient is calm but can't comprehend or understand the procedure we're doing, the standard of care with or without the pandemic would be a verbal communication with the power of, the POA or whoever's making the medical decision for that patient. And we continue to probably, have that typical standard of care, which would be a telephone call would be as effective as having a patient's family member by their bedside in that situation.
Great, thank you. I know we're running a few minutes over time. We've had a lot of great questions and a lot of great discussion. I just want to ask everybody one at a time, and we'll start with you, Dr. Baker, since you're still online here. What's, just a final thought, just something you would like to tell everybody to take away from this conversation?
Yeah, this too will come to an end. This too will pass, right? So we will be able to persevere. The healthcare system, life will go on. I think Brian, I enjoyed hearing his discussion on that. And I think that is what you need to understand. First, and next point would be that the healthcare system, as I mentioned, the more time that we have to understand this disease process, how it's affecting patients, cardiovascular and otherwise, the better we are as physicians at treating it. So give us that time, and what the community can do is to be diligent with their distancing and personal protective equipment and just following the guidelines and the rules. Don't let your guard down. And I trained at an institution where I had a lot of international colleagues and grads, and so I keep in contact with them more so now during this pandemic, because I want to know what Asia Pacific's, how are you doing there? What's my Italian guys doing? The UK, South America, and it's the same everywhere. We are not, the United States, North America is not an exception to the rule. What we are doing in healthcare, the way that we shut things down, the way that we're cautiously reopening them, the way we're going after cardiovascular disease and the procedures, we're learning from each other. And so I think it's important that patients understand that you're not alone, quite the opposite, that, right on the, drill through the middle of the world and come up on the other side, you're going to find people that are struggling with the same thing that we are here, but we're learning from each other. And I think that's the important thing.
Thanks. Thank you so much, Dr. Baker. Dr. Eberts.
I would certainly agree with what Nevin said on that. We're gonna get through this as a country, and as I said earlier, it's remarkable sometimes the resilience of people, and just looking at I've used the example to a few people, looking at what the British endured with nightly bombings from the Germans during World War II. There was what seemed to really help people is there was a shared sense of we are going through this together, we are going to survive, we are going to rebuild, and we will move beyond that. And I think since this is a globally shared experience, that in some level that will help us in a way of getting through, just like after 9/11, I think the country really managed to pull together in a unique way, and hopefully it will after this as well.
Thank you, Dr. Eberts. Gina.
So I will echo everything that has already been said, but then I'll end with kind of my soapbox, primarily as a nurse, which is if you need to go to the hospital, call 911 or get yourself to the hospital. Again, brain and heart muscle are time. And the quicker that you get there, the safer we're going to take care of you, and the quicker that those interventions can happen. So it's okay to go now. Don't be hesitant. You're okay to go into your emergency department if needed.
Awesome. Thank you. Thank you, Gina. Thank you so much for Dr. Baker and Dr. Eberts. There are tons of ways that you can stay engaged with the American Heart Association. I'm not going to go through all of them at this moment because I know we're running over time, but we're going to send some information out to everyone at the very end after this, and you'll get it via email for all the participants. And I just want to say thank you all from the bottom of my heart for joining us today, and keep these questions coming. We'll get the answers for you if we absolutely can. So take care and thank you.